Idiopathic pulmonary fibrosis is a progressive and irreversible lung disease that is the second leading indication for lung transplantation. With IPF, there is an initial inflammatory phase in which the alveoli become infiltrated with macrophages and mononuclear cells, followed by a fibrosis phase in which the alveoli become scarred with collagen. The scarring leads to thickening of the alveolar tissue and surrounding interstitial space, which causes reduced lung compliance. IPF is typically preceded by respiratory distress syndrome, and this is characterized by an acute or insidious onset of dyspnea, respiratory muscle fatigue, abnormal respiratory pattern and rate, anxiety, and cyanosis related to inadequate gas exchange. And these will all limit the endurance and physical functioning of the patient during rehab, requiring more breaks during treatment and close monitoring. So the exact etiology of IPF is not known, but it's thought to be related to inflammatory and autoimmune disorders. And the typical onset is 55 years and older. And IPF is characterized by dyspnea, a dry, non-productive cough, and a reduced physical function. There's a lack of linear progression with sudden acute attacks of respiratory deterioration, resulting in an average life expectancy after diagnosis of 2 to 5 years. A common comorbidity of IPF is GERD, and this is known to cause lung inflammation secondary to microaspiration of gastric acid.